Hi, I'm Dr. Epstein, and this is one of my favorite parts of my job, which is taking off the splint on a patient that's had a rhinoplasty. In this case, my patient is 6 days status post a rhinoplasty. You can come in and see what some of her concerns were. She had a hanging tip, over-projected profile, so you see, especially when she smiled, her tip would get pulled down. And she just had an overall wide look to the tip of the nose and took away the attention from what's really what I think is her prettiest features, which are her eyes. And so anyway, she's 6 days out, and here she is. And today we're going to go ahead and take her splint off, which is always the fun part. And we've already, you can see the stitches down here. We've already taken the tape off from the tip of the nose. And what we're doing now, this is a little bit sore. We're going to go real gentle on her. And we're going to gently go ahead and take this off. And then we're going to get to see, at the same time she does, what her nose looks like. And she has a nice smile. So, and you can see when she smiles, her tip doesn't come down nearly as much. No, I have no idea what her nose looks. I have no idea what her nose looks like.
I'm trying to both.
But I'm assuming that it healed up the way we, it's healing up the way we want it to. Feels good, right?
Yeah,
It's a little weird.
Great.
Good. Chin up for me. Great. Come around this way, Michelle. Let's go ahead and take a look. You can see now what we've done for her is taken down the bump. Done a lot of refining here in the bridge. This is probably pretty tender in here. Give me a smile. So her tip stays up much more elevated. And what I like to do at this point is put some tape on the bridge of the nose. Can I get scissors? Good, yeah, that's good. And we'll go ahead and then we'll let her take a look at it in just a minute. So as I said, she's exactly 6 days out from her surgery. It was done what's called through an external approach. And the reason why I like this tape is it lets you see sort of what it looks like with once the swelling goes away. Let me sit her up, and now we get to take a look. Alright, there you go. So you're still quite swollen here, and you can see that, but you can see how the bridge has been narrowed, and the profile.
I can already see, I can almost see my nostrils from the side. It's fantastic. Pretty. I'm so excited.
So that's what we like. Everyone's smiling. But anyway, what's going to happen over the next week or two is, this swelling's going to go away. As I said, her tip was rotated up through a lot of different maneuvers because that was one of the biggest issues. To me, the three main issues were the tip hang down, the broad tip, sort of a little bit wide and fat, and then the wide bridge, and that all those things were set in. You can see that when I press down, you can see that the nasal bones have been brought in quite a bit. The tip's been refined, but it's still swollen, and lastly, the tip's been rotated up. Not too much, but enough to fit your face. Anyway, this is Dr. Epstein. Thank you.